It's recorded now. Okay, so I guess let's move along, right, Janice?
Yeah, so thank you, Taz. So again, the focus on tonight is really going to be on COVID and how we plan to keep your campers and our staff safe. As I'm sure you can imagine, we have been working on this for a year now. We've started planning for the safe return of camp this summer, last summer, as soon as we knew we weren't going to have in-person camp. So we're going to throw a lot of information at you today, and we are also going to throw a lot of charts at you because we find charts as easier to understand. It kind of breaks down the content. We are also hosting our open houses in May. You'll hear more about the open houses later this evening. And just know that the open house will be specifically geared towards the camper. So we certainly invite your campers to attend our open house. And that's where we'll talk about all the fun programming that we're planning this summer. Feel free to take advantage of the chat box, ask away, and we're going to save most of the questions to the end. But we will see if there's anything trending. And if there's anything trending, camp directors will just kind of pause and kind of answer those questions as we go along.
Yeah, Denise, I just wanted to throw out, instead of using the chat box for the questions, put them in the Q&A. It'll help us keep track of who's answering and what the answers were. So that'd be helpful for us.
Okay, and is it intuitive where the Q&A is? If they hit the more
Yeah,
button?
yes,
Okay, I just want to make
I
sure it's
think so.
intuitive for everybody else. All right, so let's get started. So, we're Girl Scouts. So we believe in planning, and preparing, because that's our motto, to be prepared and also prevent. We want to prevent the spread of COVID. We want to prevent kids from getting sick. We want to try to prevent anybody from getting hurt so everyone can have a great time at camp this summer. So we're going to walk you through some of these steps, and we're also going to walk you through what we call NPIs. Okay, and then our next slide. All right, so life is different right now, right? You turn on the news and it usually starts with something about COVID. And it usually starts with something that's changing about COVID. The CDC has just come out with new guidelines, or the state of Virginia now says X number of people can go outside. And so it's constantly changing. Please know that we are keeping abreast of the changes as fast as we can. And we are sourcing a lot of industry experts. The CDC, the American Camping Association, the Association of Camp Nurses. We're working with all of the local health departments. We're working with the state health departments. And then, of course, the council has its own guidelines. One of the challenges that we experience, though, is that those guidelines aren't always in sync with each other. The CDC may come out and say something tomorrow, but the state of Virginia may not adapt that. So we tend to try to go with the strictest guideline whenever feasible, because again, our number one goal is to keep your campers safe. So the way we do that is preparing. And some of the things that we're going to talk about tonight is about sanitizing areas, about ventilation in the out of doors, about how we're going to group your campers together, the importance of washing hands, physical distancing, and we're going to talk a little bit about wearing a mask and the expectations around wearing masks for the summer. Okay, now here are our NPIs, and the NPIs are non-pharmaceutical interventions. We're going to go through each one of these NPIs this evening, and for each NPI, we've got something to say. We've either got a policy in place or a practice in place or something in the works. And hopefully this will break it down and be very clear to everyone. So the first NPI is screening, and I know that there were some questions in the chat box about screening. So we'll let the slides catch up.
Denise, if you just want to keep going, I'm sure the slides will eventually show
Okay,
up on your screen.
okay. Are they showing up on other people's screens and not mine? Okay, good to know. All right, so screening can be broken down into 3 categories: before camp starts, during camp, and then after camp. So we're going to talk about how we're going to implement those 3 categories, because we want campers to arrive at camp healthy. Because if they arrive at camp, then it'll be easier for us to maintain a healthy environment for them. So now let's talk a little bit about how we're going to screen before camp. So this is new information. After reviewing the guidelines for the CDC, the American Camping Association, and all the state guidelines, we have made the decision that all campers will be required to come to camp with a negative PCR COVID test. The COVID test must take place at least 5 days, no more than 5 days before the start of camp. We're going to talk a little bit about how you will share that information with us that your camper has received a negative COVID test. So again, new information to repeat the obvious, that all campers will be required to come to camp this summer with a negative PCR COVID test. You will upload those test results in Camp Doc, and we'll talk a little bit about that. It would be wise to also bring a copy of the test results to camp when you drop off your camper. If this creates a hardship for any families, a financial hardship, we ask that you please reach out to our customer care department and we will work with you. We don't want this added requirement to create a financial hardship on families that would potentially prevent your camper from attending camp. Within the next week, we will also be sending a written confirmation of this information with a letter that you can take to your healthcare provider that will state that the camp does require the camper to come to camp with a negative COVID test. In case your insurance needs proof that it is a requirement, we will also provide that. Our staff will also be coming to camp with a negative COVID test. And in addition, we will be testing our staff throughout the summer. Okay. So now let's talk about what happens in addition to the negative COVID test.
Wait,
We will,
Denise, sorry.
yes,
The question on, is it business days or calendar days? So they just want to know what the days are.
it can be calendar days. I mean, I think we're saying 5. You know, if you've got it 6, we're going to work with you on that. You'll want to average in enough time to get the results back. But we don't want it to be much before 5 days, because as soon as you get that go and get that COVID test, you know, we're also going to ask you to modify your behavior between the time you get the COVID test and you arrive at camp. I'm going to go off script for a minute. One of the other things that somebody had asked in the chat box, we are not going to restrict travel, but we are going to give you guidelines that if you do travel, we're going to ask that you continue to self-monitor your camper. But by requiring the negative COVID tests, this also gives families a little bit more flexibility during the summer to start planning for hopefully a different type of summer. But in addition to the negative COVID test, we'll be sending out some information about how we're going to ask that you modify your behavior about 14 days before the start of camp. Modifying behavior means that you're practicing all the social distancing guidelines that we've become so aware of, that you're keeping your space, that you're limiting your contact with strangers, that you know your campers and your family members are wearing masks. So I'm going to pause because that was a lot of information. So Taz, are there some questions that we need to address before we go to what happens when they arrive at camp?
We've had a couple questions about day camps, and so we are going to focus on sleepaway camps in this webinar. But Denise, do we know if day camps are requiring testing?
Yes, I can tell you that day camps will not be requiring testing because they are day camps. So we could require that you come to camp with a negative COVID test, but then you go home that night and we have no control over what you do when you go home that night. So from everything that we've read and consulted with, it's considered the gold standard for sleepaway camps to require testing. So we're going to go with the sleepaway camps. The day camps will have to fill out a 14-day pre-screen form.
Somebody would like to know what the more understanding on the difference between testing versus the 14-day quarantine and why we have both.
Because the testing is done by an outside source, and it's a medical professional telling us that your camper is testing negative for COVID. When we were reading the Virginia state guidelines, they're pretty serious about what the quarantine would look like for 14 days. And then that would be on your honor that you've quarantined, but by requiring a test, then we know that our campers are coming to camp healthy.
If you have a camper who's going to, Camp Potomac one week and, Winona the next week, they don't have to get a test in between. The
That
same
is
with
right.
CITs who are going to be going home over the weekend. They just need to be mindful of what they do on the weekend.
And we'll talk a little bit about why that will be the case. If they're going from one Girl Scout Council of the nation's capital camp to another, then they do not have to be tested. The only exception of that would be day camp. If they've attended a day camp, then they will still have to be COVID tested. But if they've attended a sleepaway camp, then they will not. Okay, so let's talk a little bit about what's going to happen when you arrive at camp. So hopefully you all received the notification that went out last week that we have had to cancel bus service to Potomac Woods and Winona. The reason being is because of the social distancing that we would be required to adhere to on the bus was just going to be too challenging. I don't know that we'd be able to secure enough buses. The reason why we're still going to offer bus service to Mayflather is because Mayflather is for most a 3-hour drive. So we are going to focus our energy on reserving buses for Mayflather, but Mayflather bus, the kids that go to Mayflather will also be social distanced. I think I jumped a little when I said that, but so when you arrive at camp, you're bringing your camper to camp, you will be greeted at your car and we will go through a check-in practice at the car where we're going to ask the camper a series of questions about how they're feeling, if they've experienced a cough, fatigue, vomiting, a fever, shortness of breath. You can see the questions here on the screen. In addition to that, we will take their temperature. Once they've gone through that pre-screening, we're still working on what drop-off will look like. It will probably be limited interaction with camp staff and limited ability to go into the units. But bear with us, we're still working out the details for that. So testing before you come to camp, and then when you arrive at camp at the gate, you will go through or your camper will go through a pre-screen process. And then during camp, every day, we will be doing a screening with the campers. I promise you though, our camp staff are going to try to make this fun and interactive, not something that the campers are going to dread. I'm sure our camp staff will go through these questions with a great deal of enthusiasm, but we just want to make sure that we're really monitoring the campers and how they're feeling. We will do a temperature check with campers every day. We will also do a temperature check with our staff every day. Anybody who starts to exhibit COVID-like symptoms will be taken to the health center for further evaluation. If your child has a stomach ache or a fever, it doesn't mean they're automatically going to have to go home. It means that they're going to have to go to the health center for further assessment. And the health screening will be done in the units by the camp staff.
All right, I think it's me now.
Okay, well, in just a second. So I just want to, so that's the pre-screening. I'm going to throw it to you in a minute. Kelsey, know that most of these guidelines that we're sharing with you are CDC or American Camping Association or state guidelines. And our ultimate goal is to create the safest environment for your camper as possible. So with that, now I'm going to toss it to Kelsey, who's going to talk about the next NPI, which I think might be hand hygiene.
Yeah, it's hand hygiene. So this year at camp, we're going to make hand washing really be a program activity. So we'll have built-in time in the schedule for hand washing for at least 20 seconds. So camp staff are really going to work closely with campers to ensure that they're washing their hands frequently, especially before meals and then when using program areas. Our property team is really awesome, and they've already started installing some hand sanitizing stations at program areas that don't have water access. For example, our archery ranges, as well as slingshot and tomahawk ranges, are a couple examples of the areas that now have hand sanitizing stations. So that will be available because there is no water access there. Next slide, please. And then face masks. So everyone is going to be required to wear a mask. This mask has to have a minimum of 2 layers when they're interacting with anyone who is not part of their pod and when indoors, except if they're in their cabin or Glen Shelter. If they're showering or eating, they don't have to wear their mask. And I will clarify, we're going to touch on this a little bit later about the cohort and pod definition. But a pod is basically the other campers in a Glen Shelter or platform tent. So that would be those 4 girls are a pod. Next slide. And then we are going to ask that campers bring a minimum of 2 masks per day. Masks should be packed in individual Ziploc baggies and labeled for each day of the week. So as you can see on the slide here, you can label them for the day of the week. And make sure you put your camper's initials on them because they might easily get lost if you don't indicate your camper's initials. So again, these masks are going to be worn when you're not able to social distance outside, so under 6 feet. It wouldn't be worn in the Glen Shelter with the girls who are in that shelter. So during FOB or me time, the girls will be able to be in the Glen Shelter and not have their mask on. Also, when they're eating, they can't wear a mask. When they're in the pool, they can't wear a mask. And then when they're sleeping, they will also be not wearing masks either. Okay, so now we're going to talk a little bit about cohorts and pods. So we're going to keep campers into small cohorts while they're at camp. Cohorts are basically the program that the camper is registered for. So for example, Water Otters at Potomac Woods, that is a cohort, that's a program. This group is going to spend the week of camp together. They'll sleep in the same unit, no more than 4 girls per sleeping structure. They'll have meals together, they'll do all the activities together, and the 4 campers in the sleeping structure are known as a pod, like I said before. So these pod members, these fellow pod members, campers can interact with them without a mask on. Camp staff will also be assigned to the same cohort group throughout your camper's time at camp. So you have your unit counselors and unit leaders specifically assigned to a program or cohort. They will stick with those campers throughout the whole week. Some exceptions to cohorting may be made if there's a medical need within the unit that would require the health staff or the inclusion specialist to be in the unit and interact with the campers. Campers will also go to program areas with their cohort groups, and they will interact with specialty staff like lifeguards and program specialists, but we will continue to implement other NPIs while they are interacting with the specialty staff. So a little bit about group sizes. So we're going to have smaller group sizes at camp this year. And like I've been saying, fewer girls per cabin. So in past years, it's been 5 to 6 girls in a Glen Shelter platform tent. This year, it'll just be 4. So it'll give us a little bit more space in the cabin. So brownies will probably enjoy that extra space just because they can spread out a little bit more. And group sizes for cohorts are also going to be smaller at all 3 camps. So program capacities or cohort sizes will range from 8 to 20 total. And groups of girls will range from 8 girls and 2 staff for younger girls to 12 girls with 2 staff for older groups. So it kind of depends on who's registered, but typically 8 to 20 per cohort. And also, as in years past, we will be doing our best to make sure buddies are still in the cabins and grouped together. So due to our reduced capacities this year, we really encourage girls to attend camp with no more than 1 designated buddy. So make sure you put down that buddy on your Camp Doc Health form, which we'll talk a little bit about later in the webinar. But yeah.
And Kelsey, I just wanted to add, because sometimes there's confusion. For a girl to be in the same pod or cabin as a buddy, they have to be registered for the same program, the same week at the same camp.
Mhm.
Because of the way our cohorts are set up, our programs don't really overlap. So they have to be in the same program, the same week at the same camp.
Yep, that's a very good clarification.
Oh, but before we move on, I would say there's somebody asking about washing out masks. And we're hoping campers bring enough masks to get them through the week to send home to wash. So we'd like at least 2 masks per day so that they can change. And then we'll have just like extra disposable masks at camp if a camper suddenly damages all of their masks and they're all unusable. So we'll be able to cover that. But all masks will go home to wash.
Okay. So like I've said before, if there is a medical need within the unit, or if your camper is going to a program area, they will interact with those other staff. But again, these pods are really going to be our smallest cohort, so they can interact with their fellow pod members without a mask on. Um, I think I think I've kind of covered the rest of this slide, so I think we can go ahead and move on, and I'm going to pass it over to Emily for sanitizing.
All right, so our next MPI is sanitizing. So all campers and staff participate in camp capers during their time at camp. Capers are like chores that allow all campers and staff to take part in keeping camp clean and running smoothly. And so this summer with COVID-19, we're adding an extra level in. And so each camp will be hiring a few extra staff members to specifically work on sanitizing those high touch areas. So, like the bathrooms, doorknobs, light switches, those are going to be cleaned several times a day. We're also going to be thoroughly cleaning the sleeping shelters in between sessions. At our camps, the campers sleep under mosquito netting, and those mosquito nets will have a 48-hour rest period in between sessions. And then we have ventilation, which is probably the easiest MPI for camp. The majority of our camp activities are already outside, and this summer we'll move a few extra outside. So if it's nice out, instead of doing arts and crafts in the arts and crafts building, they're going to do it outside. When it's necessary to move indoors, windows and doors will be left open to increase ventilation and airflow. For those hot summer days at Winona and Potomac Woods, we'll use the air conditioning in the large lodges that have it, but we'll keep the windows and the doors open to make sure they're getting enough ventilation. The Glen Shelters have screen windows, as you can see in this picture here. And then with the platform tents, which you might be able to see in my virtual background, we can actually roll up those tent flaps um, so that we can get more ventilation in the platform tents. So then we have physical distancing. So throughout your camper's entire stay, we will be practicing some level of physical distancing. Our primary source of guidance for social distancing is going to be our state guidelines. And so, like, if the CDC is saying 3 feet, but the state is going to say 6 feet of social distancing, then we're going to have to go with that 6 feet. And so, some of this stuff is just still a little bit flexible as we get final guidance from our various sources. Girls will not need to social distance from their pods, and that's that group of four that Kelsey mentioned. When campers are singing or cheering, then the pods are going to be even farther apart. So they're going to be like 10 feet apart when they're like projecting more. And then we'll also, again, we're leveraging ventilation and taking advantage of the outdoors to allow campers to have a chance to just, spread out in an open space outdoors and take a mask break. All right, so that's the end of our NPI safety review. And so now we're going to take a look at some of our other areas. So next we have transportation. So currently, based on CDC and state recommendations, as well as low enrollment, we are unable to provide bus transportation to Camp Potomac Woods and Winona. We're making the best effort to provide bus transportation to Mayflower. Campers will be socially distanced on the bus, and the capacity will be reduced to 50%. With the reduction of bus capacity, we will need to increase our transportation fees for Mayflower, and so that will go from 50 to 64. We also hope to have our bus stop location secured in the next few weeks. And once we have that bus location secured, then those Mayflower campers who are registered for the bus, they'll be notified about how they can pay any remaining balance through eBiz. Any fees that were paid towards bus transportation at Potomac Woods and Winona will be refunded. And then again, don't forget to put on your mask before you get to the bus stop or, right when you get to camp. Or if you're carpooling, go ahead and put that mask on once you start. All right, so check in and check out. So check in and check out times will be extended. 2 weeks prior to your camper's arrival, you'll receive an email with your check in time. And so we're looking at 12 p.m. to 5 p.m. And check in times are going to be assigned according to their program so that all the programs who are attending, say, pajama party, all of those campers are going to arrive at the same time. And, we understand that people, have multiple campers who may be sisters, but they're attending different programs. We understand that and we'll make accommodations for that. So you would bring them both to the earlier check in time. And again, all families will be required to wear a mask when dropping off and picking up their campers. So next we have our final payment and some information about that. So the final payment, that deadline was moved to May 3rd. And so all payments have to be made online through eBiz. And that's where you registered for camp. So you'll log into your account on eBiz, and then you'll want to click on My Family, go to Family Order History, and that will show your camper's order with the balance amount that's due. And then you just have to click the green Pay Now button next to your camper's order, and you'll be able to pay for that. If your plans have changed and your camper is no longer able to attend camp, please contact customer care and they can take care of that cancellation for you. If we receive a cancellation notification by April 12th, then we'll refund your deposit in full. Cancellations that come in after April 12th will not get that full $50 deposit back. All right. And then financial assistance. is still available for up to 70% of your camper's program fees. And we've got a SurveyMonkey link that you can apply for financial aid. And it's available for one camp session per camper. So if they're going to multiple programs throughout the summer, they can only use financial aid for one of those programs. And we talked about cancellations. All right, so then we have meals. So we're still working with our professional food service to plan how to safely serve meals to all campers and staff at camp. We're preparing for a large variety of options to accommodate smaller group sizes, including uh, doing multiple meal shifts, eating outdoors, additional packouts, as well as delivering food to the various units. So we're not, typically at camp, everybody eats in the dining hall. That's going to look a little bit different this summer. Instead of doing an open buffet style salad bar, pre-packed salads are going to be made ahead of time by our food service staff. And snacks during the day will be prepared in individual portion. And like we have in the past, we'll continue to work with families to accommodate uh, dietary restrictions and food allergies. And you'll hear more about how to let us know about those when we get to our health forms. I think that's all we have for meals. So I'm going to turn it over to Megan now to
Um,
talk about.
yeah, thanks, Emily. I'd say before we dive into health forms, which can be overwhelming, let's go over a number of our questions because I've been trying hectically, but there's still 50 of them that I haven't been able to answer. So if Denise is ready, most of these questions are probably for her to
I'm
answer.
ready.
Okay, so they're asking for a little bit of more of an explanation about PCR tests, and you might have answered that live and I missed it. But what does a PCR test mean, and how is it different than a rapid
Someone help me
test?
with that answer. I mean, it's the type of test that it is. The PCR is I think, the molecular test, and that's the one that usually has
Yes,
to
good
go
job.
out to a lab, and it is known to be more accurate. So it's PCR, molecular. The rapid test is the one that usually you get the results back within an hour or two of having the test done. We're learning as we go. I know more about
Yes.
testing of COVID than I ever thought I would. I know someone also said, well, what happens if we've gotten the test but not gotten the results and camp is starting? We're still working through that, but here's what we think that will look like. We will want you to come to camp showing us proof that you have taken your camper to get the PCR test. Usually you get an email confirmation or you get something that tells you the website to go to get the test results. You will bring that to camp with you, and then we will either tell you to go into town, we'll have a place identified where you can get a rapid test, or there is also the possibility that with you present, we will do a rapid test on site. But we're still working out the details for that. It is our goal not to have to turn any campers away, but where you can be helpful is to show up at camp with proof that you did take your camper to get the test.
Um, yeah, so another question is they're looking for a little bit more explanation about the 5 days before camp. And I know that we discussed like what day that might be. I can answer that if you'd
Go
like
for it.
to. Okay, so if your camper's arriving on Sunday, then I believe 5 days before is Wednesday. So that's Wednesday, Thursday, Friday, Saturday, Sunday. So you want to make sure you get your test done on Wednesday at least so that you get your results back in time. I know when the pandemic first started, it took like 14 days to get results. But I know based on my tests recently and those that I know of around me, that our results have been coming back within 1 to 3 days. So we're having a very good turnaround with results. But as Denise just discussed, if you're waiting on results, but but you've got your tests and you've done some transmission mitigating procedures for fancy words. So you wore a mask, you washed your hands, you didn't go around hugging strangers, then I think we're probably pretty safe. So Wednesday is 5 days before. So it's not waiting for results 5 days before. You want to get tested 5 days before so you get your results before you arrive at camp.
And we are going to attempt to explain this in writing. And we are also going to continue to update our website and our Facebook pages. And we'll talk a little bit about that, but we understand it can get confusing. So we are attempting to make it a little clearer in a written format.
So, Denise, we've also had two questions about if can campers attend a different camp the week before, or can campers go to public school the week before camp?
They can, and part of the reason why now they can, that's part of the reason why we're requiring the COVID test. We realize and understand some kids may be in school, a week, they may go to school the Friday before camp starts, and then camp may start on that Sunday. So part of the reason why we decided to go down the path of requiring the test is so we could give families a little bit more flexibility. But we're also asking for you to be smart. And, and the type of behavior we're asking you to practice, or the COVID mitigation practices we're asking you to put in place, are things that you've probably become very accustomed to. It's the social distancing, it's wearing the mask, it's watching your interactions with people you don't know, it's washing your hands, and screening your camper, and just keeping an eye on your camper's symptoms.
Okay. Um, I think that's it. There's a lot more questions about test results and stuff. So, like, we can go back through those, and we'll also try and we'll collect these answers and try and provide those in more education later. And Kelsey and Emily, if you guys can take over the questions, and I'll start the overwhelming health form process.
Yeah, and then just to speak to that, Megan, I'm glad that, you suggested that they do it in the Q&A, because as you said, we will capture all the questions
Mhm.
now. And I see us working on a document that will be a Q&A document where we'll be able to address a lot of the questions, because there's definitely some similarity in the questions.
Okay. So if you registered for camp, you probably easily missed it, or maybe you saw it, that there was a hyperlink for this document on the screen, our Sleepaway Camp 2021 Parent Information Book. So keep in mind that that book was written in January for registration, and it's April, and a lot of things have changed since January to April. And we tried to keep it living and updated, but with things changing so much, we haven't been able to make an updated version of that document yet. So you'll see things like bus transportation for Winona and Potomac Woods, which we've removed. But you always want to go to our website, the gscnc.org/camp. And the Sleepaway Camp will have the most updated information on that website. We update it at least once a week. So you'll want to go there for that. In the information, and a lot of you have already asked about it, our camp doc, and that's where we collect all of our health forms. Same as the NOAA updates for the parent packet is things have changed. Virginia changed their regulations, Maryland changed their regulations. I think CDC changes theirs like every week. And so that's really nice and reassuring for us, but it also makes it difficult for us to actually get you the most relevant information. And so our Camp Doc forms, which we anticipated going out in March, were delayed because of changes in regulations and a little bit of restructuring. I'm currently in the final processes with Camp Doc, and we do anticipate that they should be going out by the end of next week. Um, if not sooner. And so you'll get an email from a website that says Camp Doc. So at campdoc.com, the same thing you see on the screen here under this cute little Dr. Man. And you want to make sure that that email address has been added to your approved emails. So let me go ahead. Okay. And so all the forms that you're going to complete on the Camp Doc website, on there we collect a health form for all campers. And when you're submitting your like your information for your camper, that's where you add your buddy request. And so it's in there. You can change it as many times as you want. If Susie and Annie get in a fight before camp, you can take it out and say we don't want to be buddies anymore. You can change it all the way up until June 1st when we're going to lock the forms. After June 1st, you can still make edits and changes because, again, things change all the time. You'll just let the camp staff know or log in and request it to be unlocked for you. So we have a health form for campers to fill out, and that's all campers. It does not include a physical. So if your camper doesn't fall into the next couple of categories I'm going to talk about, you can fill out most of this paperwork all by yourself without the doctor as long as you're honest. So then you'll have the specialized healthcare forms, and I'm going to go into those in detail in the next few slides. And the specialized healthcare forms are for campers that have asthma, they have diabetes, or they have an EpiPen that they need to bring to camp. There's also medication forms. All of those do need doctor's authorizations. We need to know what the doctor's plans are, the recommendations are, and that's for everything from over the counter. So, say that they have a very mild allergy to, I don't know, bees, not a bad one, but a mild one. It could always go bad. And they only need to take Benadryl. We still need a doctor's authorization for that. Say that they get regular headaches or they have joint pain and they need a higher dose of Motrin than your regular dosage. We need a doctor's authorization for that. So there's also in there, you'll see authorized camper pickup form to fill out. And there's a Meet My Camper survey, which I couldn't find the link for today, but we'll send that out to everybody and it'll go up on our parents' Facebook pages. So you want to make sure that you have all of those. Let's see, let's dive into our forms. So, our first form that I said is the camper health form. It's required for all campers, easily completed by our parents and guardians. And you want to make sure that you're thorough. It does not require a physical, you do not need to visit the doctors, and that's due by June 1st. This form also alerts us to any dietary restrictions, allergies, recent injuries, the loss of the family pet, anything you think might be relevant. We want to make sure that we know as much as we can to have them be successful. The difference between if your camper happens to be attending either Potomac Woods and Mayflower and Winona, Winona requires you to have the actual date of your camper's last tetanus shot. The other camps just need to know what your immunization status is. Now, for campers that need medication, the form also covers medications that we provide at camp. So, just like at home, we have all of the generic, regular, over the counter medications you might need to treat most anything from a sore throat to a boo boo to an upset tummy. We have all of those. I don't really want to try and say the generic names. I'm just going to go for the brand names, but know that we use the generic versions. So we have Tylenol, Motrin, aspirin. Well, we don't have aspirin. We have aspirin muscle rub. We don't give kids aspirin. We have bacitracin ointment, calcium carbonate, which is the fancy word for Tums. So when you're filling out the health form, go through and authorize what we can and cannot provide to your camper during their stay. All of the rules and all of the procedures we follow are written by a nurse practitioner. So our health staff, which are usually medical students and or RNs on site, consult with her, consult with the procedures before medicating your camper, and will notify you if they have treated your camper. So if your camper again needs regular Motrin, you're concerned about it, when we have it, as long as it's not a daily medication or more than the normal dose, we can probably provide that for them. Now, specialized healthcare forms. These are required for campers who have EpiPens, inhalers, or diabetes. So, also, if they have an EpiPen or an inhaler, we need you to bring it to camp. If they have an EpiPen, ideally at camp, we would love you to bring two EpiPens. We'll keep one in the health center and one with a unit at all times so that we can follow up with a second dose if needed. These all require doctor's authorizations. And the only exemption to this form is if you have a form with school or any other group, and you have this same asthma action plan or an epi plan, and it's already signed and approved by a doctor, and that signature will be within a year of attending camp. So, say your camper's coming the week of June 20th to camp, and that signature was done in August, it's still good for a whole year. So, we can accept that form in its place. And if you have questions, you can email us and ask us if this form is appropriate. So on the healthcare form, you'll see it has its own medication authorization section. So if your camper doesn't take any medications except for the emergency medications or the asthma inhalers, that can be included on this form and authorized by their physician. So you'll see it on the back of this section for you to have the doctor authorize. Oh my goodness, authorize. So, and you have to bring this form with the medication to camp. That's it. So now let's talk about other medications. And if you're bringing any medication to camp, you can generate it on the pre filled Camp Doc form or download our form. Either way, in Camp Doc, you get to type in the medications and the dosage and the routes, all the ways that they can take it. You want to have a doctor sign that form and then bring it to camp. Potomac Woods and Mayflower. Oh, cool strip's still on here. So, Potomac Woods and Mayflower, only you need to fill out that form. No doctor's signature is required for those camps for just general medications. But Winona, it's in Maryland, and Maryland has a lot of rules. And Maryland says a doctor needs to sign that form. And medications include everything from your melatonin and Flintstone vitamins to anti anxiety meds. So, whatever your camper needs, if it's an over the counter medication, if it's a prescribed medication, if it's a special ointment or lotion, we need to have that written onto the medication form so that we know how to properly take care of your camper while they're with us. And again, Winona needs that form signed by a doctor, but when you're in Camp Doc, you'll see that Virginia camps have a different form. Camp Doc's smart enough and it'll tell you what form you need. It'll just click it, the download template for you. Now, when you're bringing the medication to camp, this is also gone over in the parent packet. And we're going to record a special webinar just about packing medications and filling out the forms. And that should be sent out to everybody by the end of the month. We'll post it on our parent Facebook pages just to help you out with all of the steps. But when you're bringing the medications to camp, they have to come in their original labeled container. Um, which I thought was really funny. I recently picked up a medication from the pharmacy and they gave it to me in a Ziploc bag with a pharmacy label. And I laughed and said, I wouldn't know that's real if I was at camp. So, but now I do know that that's a thing. But they need to come in their original labeled container, and that includes over the counter meds. So don't pre sort them into the pill dispenser like you see on the screen. We want all 20 bottles just pre-labeled, ready to go. And then you want to put them all together in a Ziploc bag and label it with your camper's name and session so we can keep them all together. And we put the form inside that bag. So everything we need is in one place. Now, the authorized pickup form is another form that you're going to have to fill out in the Camp Doc system. And this tells us who is allowed to pick up your camper from camp and their medications. So they're going to pick up everything that came with your camper. And you'll see new this year, there's a code word option. So, depending on how we're running checkout at camp, you might be asked just to provide a code word. And then we'll match the names and photos, IDs of the people on there. But you might not be asked to actually sign a signature box. That code word is your verbal signature. So, if you're sending anybody to pick up your camper, you want to make sure that they know what the special code word is. And when you're filling out this form, you need to use legal names. So we can't write down grandma and grandpa. We want to make sure that you also include yourself, which I know a lot of parents usually forget to include themselves. But when they show up to check out, it's really awkward for us to say you're not on the list. So make sure the first name you write down is yours and then add everybody else afterwards. And this includes bus pickup and camp pickup. So if you're picking up your camper from the bus stops for Mayflower this year, we still need this information. This tells us who we can legally release your camper to. Okay, great. Before I dive into the rest of fun things with this beautiful picture, do we have any questions that I can answer?
So we had a question about sunscreen, and
Yeah.
if it's considered a medication.
That's a great question. And I'm glad you brought that up. In the health form information, it's actually in the authorization section. You'll see a question that says, "Is your camper bringing sunscreen?" Basically, that camp recommends your camper brings sunscreen and insect repellent. Will you be providing those? And what brand name they are? They're no longer considered medications, so they don't need to be on the medication form, but they do need to be recorded on the health form. So write down that they're providing them. We don't have enough to provide every camper, and we don't know everybody's allergies. So bring the sunscreen and insect repellent that's good for them. And they're not allowed to share with friends. There's also a box for you to check on if your camper needs assistance in applying the sunscreen or insect repellent. So a lot of our brownies, even some of our kindergartners that come to camp, just can't reach their back and just aren't good at rubbing all of the white sunscreen in. And so our camp staff will help when necessary, but we really do encourage girls to use the buddy system. So if they have come with a buddy or they made a buddy at camp, we try and encourage the girls to help each other where they can. But that box allows us to have the camp staff assist in sunscreen and insect repellent.
And Taz, can you address picky eaters? Not that we have any campers that come to camp that are picky eaters, but can you talk a little bit about that?
Yeah, I'm glad you said that, Denise, because picky eaters are going to be just a little different this year. So usually we have a salad bar that girls can go make a salad from. And at Winona, I encourage girls that salads have to have green things as well as croutons and shredded cheese. So they can't have the croutons and shredded cheese unless there's lettuce. So we don't have a salad bar this year, but we still will have salads at meals, which I know girls enjoy. If we have a girl that's a particularly picky eater, she doesn't want anything provided to her even though it's kids friendly. It's like chicken nuggets, there's some french fries, there's usually quesadillas. Um, then what they do is they'll come to their staff person that they're with and let them know that they're just not interested in all these things. The staff are also closely observing. So a girl who has barely touched the food on her plate, the staff will check in with her. But if they let us know, then what we do is we take them to the kitchen and offer them a soy butter and jelly sandwich. We don't have peanut butter at camp, but we do have a replacement. And if they just want a jelly sandwich, maybe they want a cheese sandwich, maybe they want a bowl of buttered noodles. And so we try to have all of those options available. And if they just aren't ready for any of our ready made options, so all of our sandwiches or go to boxes of cereal, then we really do work with the camp chef to keep some stuff ready that he can heat up really quick. So usually buttered noodles are a way forward, maybe an additional salad, extra vegetables. So we really encourage the girls if they're not happy with what they're eating, like they just can't do it, that texture is not good for them, let us know and we'll try and accommodate them, but not as accommodating as a dietary restriction, like an actual allergy. But I tell you, I very rarely have girls that won't eat anything that we have at camp. Do we have any more questions?
Well, we do, but why don't we go ahead and move on, and then we'll kind of wrap up with a lot of Q&A.
Great. Okay. So this beautiful scene on the screen is wonderful. And so we're still looking for some camp staff. I know many of you guys know that we usually have international staff that come to support us. And with everything up in the air, it's still not sure if our internationals be able to be vaccinated and come over in time for camp. So we're really trying to get some more American staff. And so we'd really like if you know anybody that is 18 and over, reliable, a good mentor, willing to work for even half of the summer, go ahead and send them our way. You can use that website there, the gscnc.org/work at camp. They can see all the job opportunities that we have. We really just need some extra mentors to help our girls through this summer. So if you know anybody, send it out. And then Denise, it's on you. I think we only have a few slides left.
I think we only have a few slides, and then we'll go and do a deep dive with Q&A. So wow, a lot of information, right? I mean, we told you that it was going to be heavy in COVID, but hopefully your takeaway from this is that we're working very hard at keeping your campers safe this summer. But with that said, we're working just as hard in helping them have a great summer. We recognize that kids need the outdoors and need that in-person environment now more than ever. I mean, they've been sitting in front of computer screens and isolated and prevented from being able to see their friends for almost a full year, actually over a full year. So we can't wait for them to return to camp. But we know that camp will look different. And we also recognize that kids and maybe parents might have a little difficult adjustment this year because, families have become so family focused over the past year. You're working in a one room and your daughter is at school in another room. And whenever she needs you, you're right there. We recognize the fact that campers probably haven't had slumber parties with their friends in over a year now. And then bam, they're going to come to camp. There's going to be no mom. There's going to be no dad. There's going to be no big brother. There's no going to be no pet. So we're prepared for that. And we're prepared to help the campers work through that. But we also encourage you, especially those of you who have younger campers, well, actually, even our older campers, because our older campers are very aware of what's happening in the world, we encourage you to start having those conversations now with them. Make talking about going to camp a weekly conversation that comes up. Help build that excitement with your campers and assure them that we are going to keep them safe. You can tell them, I spent an hour and a half on a webinar where all they talked about was how they were going to keep you safe. Assure them that they're going to have fun too. And we're going to talk about the open house in a minute, but the open house will be geared towards the camper. We'll talk to the camper about what will happen if they get homesick. We'll talk to the camper about what happens if they don't like the meal. Every once in a while, we'll pause and we'll kind of give a nod to questions that parents might have too. But now really is the time to start preparing your camper for this experience that they've likely not been able to have for an entire year. So with that, I think the next slide is open house. And so these are our open house dates. And again, we will be posting this on our website. We will post this on our Facebook page. This will also go out in the letter that we'll be sending to families with the registration link. So the open house days, I can't read. May 18th is for Potomac Woods. May 16th is for Winona. And it looks like, is that May 18th for Mayflower?
Yes.
All right, so those are the open house days. And again, really geared towards your camper. It'll be child focused and hopefully will help build the excitement for the campers to come to camp this summer. And then just a couple ways to keep abreast of the constant changes is make sure that you continue to check our website, which is GSCNC camp at gscnc.org. That will take you to our camping page. We will make sure that we date stamp that anytime we provide updates. It'll be a live document and probably constantly changing. Also, if you're a Facebook person, we encourage you to join our Facebook page. It is a private page. Even if you're not a Facebook person, we encourage you to join it because it's also a great place to talk to other parents, to ask questions, and get advice from parents who have been sending their campers to camp for years. We will periodically do direct messaging through email as well, but please make it a habit to stay informed, to check our website. We're committing to every 2 weeks at a minimum to provide updates on our website. If you go to our website now, you'll see that last week we updated the website to kind of discuss a lot of the MPIs that we just went over today. We have not put information on the website yet about the requirement for a negative COVID test because we wanted to be able to share that in person or virtually before we posted it on our website. So again, that's a great way to stay informed. Okay, I think we can pause, take a deep breath, and attempt to answer some questions.
Okay. think Emily was leaving.
Yes, Emily left.
Yeah, she's gone.
Emily actually has got an FOB tonight with her CITs and her JCs.
Yeah.
The CITs and the JCs who weren't able to go to camp last summer, she's been meeting with them virtually for an entire year. So they've really started to build a bond and a friendship. So that's where she's gone.
Okay, so I think Katniss has been very good about monitoring. Katniss, I can start at the top, which is really old questions. But have you seen any pop in that are really relevant, like urgent to answer?
I want to answer one about staff behavior and how we're going to monitor the behavior of our 20-something staff. And we recognize that that is going to be a little bit of a challenge. We cannot dictate to them what they can and they can't do on their time off, and they will need time off. They work very hard. So, but we will educate them and we will talk about it. And I think I mentioned this, we're not only testing them when they come to camp, but we will be testing them on a regular basis. Our staff will be expected to follow all the procedures that campers are expected to follow. Our staff will absolutely be expected to wear masks. Our staff will be expected to social distance and practice the same procedures that our campers are expected. We're also going to encourage, although not require, but we are going to encourage our staff to get vaccinated. Just an example, I did second interviews on 2 staff members today, and I lightly asked both of them, so can you tell me how you feel about getting a vaccination? And coincidentally, they both had just received their vaccinations. So we're hoping that the majority of our staff will be vaccinated. All of the camp directors are vaccinated. I'm vaccinated. So we certainly understand the importance of that. But monitoring 20-year-olds' behavior when they're off property has always been a challenge. But we try to hire mature individuals who make good choices.
Oh, okay, yep. There's a lot of questions about PCR tests. One just was asked, which I'll take. There will be a spot in Camp Doc, which I'm working with them to build, to upload your PCR test, and the Camp Doc accounts will be unlocked. We're trying to see if they can auto unlock for you to upload that the week before camp in your 5-day period, or if the camp staff have to manually unlock it. But there will be a spot in Camp Doc for you to upload your test. And if for any reason you can't get it into the system, just bring it with you to camp.
And then I see a question about travel out of state. We are not currently restricting travel outside of the states of, now notice I said we are currently not restricting or do not plan to restrict travel this summer outside of the states that our council covers, the Pennsylvania, West Virginia, DC, Maryland, Virginia, Delaware. I think those are the ones, Pennsylvania. But know that that could change, and again, it's the environment that we live in. Right now, it's our hope that we will not have to restrict travel outside of those areas, but we also understand that that could change based on the state requirements, CDC and the American Camping Association. But again, I go back to the PCR test and we go back to please make wise decisions and know that your campers are coming to a congregate setting where they will be interacting with lots of other people, and we want to keep everybody safe. Somebody had suggested neck cords. We are looking into the possibility of purchasing those for the campers. If you've not seen them or are aware of them, I use one. I think it's great. I can clip my face mask on to it. So when I take my face mask down, if I'm eating and I take my face mask off, I'm not setting it on the table. It's not blowing away. It doesn't fall on the ground. It's just hanging there. And then I pull it back up and I put it on and I'm good to go. If we're able to secure those for the campers, we will let you know. But in the meantime, you may want to keep your eye open for them.
There's a lot of questions about buddies, so I'll just try and lump them all together. So a lot
Great.
of our I know everybody always you hear us talking about buddies, 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 but the actual percentage of girls that come to camp with a buddy is less than 50%. Our camps are designed for an individual girl experience, and if you talk to our older campers, our teens, they'll tell you that they have camp friends and then they have real friends in real life. And so they're very different. So a lot of our girls don't come with buddies. And we are only allowing like one buddy this year because of our reduced capacities. So it'll be very, very, very rare that your daughter who didn't come with a buddy will be in a cabin with three girls that are all best friends. We talk to the parents of those three girls and we really encourage them to not do that because it will exclude that fourth girl unintentionally, no matter how nice they are. So we try to work with parents to separate those larger groups into multiple cabins. The first thing that we do on Sunday when the girls arrive are name games and get to know you games and really try to get the girls all to know each other because, again, a lot of the girls come without buddies. And then, what was a question? I think that was most of those questions.
I think, Taz, you may have said this, that we do not put four girls in a cabin, three of which are buddies, and
Right.
then a fourth girl who's the odd person out. We won't do that.
We
And
don't.
I apologize. I was looking at the questions, so you may have already answered that.
Yeah, I did. There's a couple of parents I have talked to, and the best, because there's three girl cabins, the best response is to separate all three of those buddies. So they still get to do activities because a buddy really just means that they're sleeping in the same cabin. Otherwise, they're doing everything else together. So when you're thinking about the amount of time you're sleeping, which is 8 hours versus 24 hours in a day, um, that's the really only difference. So if there's three girls coming together, the parents I've spoken to, we talk about putting them in three different cabins so all the girls can have an equivalent experience of making new friends, but still sharing the camp experience together during the day. So we really try to do that.
Well, also, I see a couple of questions about kids that may be nervous about coming to camp. A parent had asked about check-in, are you going to greet the camper before you actually start asking them the questions? Absolutely. Everything will be done with a soft touch. The staff that we're hiring, they're used to working with children and they understand that we have to approach things with a soft touch. And again, open house will address that, and again, we'll talk to the campers. So you might be a little nervous about coming to camp, right? Here are some of the things we're going to do to keep you safe. Clearly, we won't go into it at the level that we went into it with all of you today, but we'll set the stage so they know what to expect. Also, one of the documents that's been put into the chat box that I also want to reference is the parent information packet. We have shared the link to that. It is also on our website. We will make sure that we share the link to that on our Facebook pages. Great source of information. That's where you're going to find the packing list and things of that nature. Although as I'm saying that to you, I'm realizing that we're going to have to update it because it will need to be a live document. And we've made some changes since that document went out, especially as it pertains to transportation.
Okay, so there's a question about can the camp nurse provide rapid COVID tests? And the answer to that question is that we will be testing our staff weekly in between camper sessions. But if a camper is COVID suspect, they're displaying symptoms that aren't associated with allergies or any other possible condition, then we'll call the parents to have them come get tested. As I mentioned previously, we have a nurse practitioner that outlines our procedures, and she actually has a very detailed process on if it's this symptom, check for this and this. If it's this symptom, check for this and this. But if we do have a camper that is COVID suspect, we'll be notifying those parents to come pick them up for testing. And before everybody asks, we don't know exactly how you'll be notified if that camper is sent to testing or if you'll be notified and when you'll be notified. We don't have those answers just yet. But we will make sure that everybody is regularly screened daily and that everybody's testing before they come and making sure that we do all of those things. I think that was a combination of three questions. So, Denise, people want to know since we can't require vaccines, will we let parents know the percentage of staff and other parents that are vaccinated?
I'm not sure because some of that is HIPAA protected. Sharing health information on our staff falls under HIPAA protections. So you will be notified if we feel if your camper has been exposed to COVID, you would receive information, much more specific information. That information may say, through our contact tracing, we do not believe that your camper interacted with this person, but we want you to be aware of this. Or it may say that the staff in the unit have been vaccinated against COVID. But I don't know that we can share the information because it is HIPAA protected, because it pertains to the health of a staff. It pertains to something health related.
So Melanie would like to know if all the links that we shared will be sent in an email as well. I will be able to email the people that registered for this event, but those people that will be watching the recording won't get that email. So instead, what we'll do is we'll make sure that we share all of those links on our parent Facebook pages. So if you haven't joined them yet, go ahead and sign up to join them. If you can't find the link to join the Facebook page, you haven't seen it in any of your other emails, send us an email to camp@gscnc.org and just let us know that you need to join the Facebook page. When you request to join, it does ask you to answer some security questions for us, such as your camper's name and the program that they're attending. So if you have a friend who you invite to the page, we can't let them in until they answer those security questions.
Um, Katniss, I'm going to throw one to you. Somebody's asked about what they should pack their child's clothes in. What type of luggage should they bring to camp?
Yeah, that's a good question. Honestly, I've seen it all. So I've seen the roller bags and the duffels. I mean, trunks as well. Just make sure that they can fit everything into that one bag. It's really helpful if it can all fit in one bag as opposed to being multiple different bags. So roller bags are good, but duffels are good as well.
Tip and trick for younger campers is parents will pack their clothes in a gallon Ziploc baggie for each day of the week and mark what day it is. And then hopefully we're going to do our best to make sure that they go home with all those Ziploc baggies opened and not still neatly packed in their suitcase. But for our younger girls, first time campers, that's a great tip trick. Okay, how are we doing on
Oh, I'm sorry. I was answering a question. Somebody was reminding me that not everybody has Facebook pages. And that is correct. I currently don't have a personal Facebook page either. So the links that we've discussed are links to the parent information book, which were all sent out in confirmation emails. And so they're all links that people should have seen before if they don't get them on Facebook. And we'll make sure that we have them updated on our website as well. So you can go to the website to get all of the updated information.
And Taz, vice versa, somebody also asked if we could post the links again, and you can probably do that quicker than I can. Can
Um,
you put the
yeah,
links in
I have to do it
again?
one by one, but if you guys distract with chatting, I can get it.
Okay, we'll distract with chatting. Well, let me go to the questions again and see how we're doing with questions. If a camper is attending Wednesday to Friday camp, will she need to get a second test in order to a camp that starts on Sunday? I would say no. But bring the Wednesday test. The fact that she had a Wednesday test, bring that test. So when she comes that Sunday, you can show us that.
Yeah, I think, and there was another parent that asked a very valid question about the mom and daughter program. So if they come for me and my gal, and then their camper is coming for a half week on Wednesday, do they need to have two tests? And I think that we're going to do the same as if they're going to different camps. Just have the test for the first program, and then do your best to quarantine and mitigate in between. And you won't have to get two tests.
Because we're going to believe that we're trying to keep them as safe as possible. I know someone did ask, well, if I'm going to camp with the Me and My Gal program and I'm vaccinated, will I still have to be tested? And the answer to that question is yes. Just like our camp staff, we will be testing all of our camp staff, even those who have been vaccinated.
Okay, I have shared all three of the links into the packet, and then now I'm sharing the direct link to our website that we refer to.
Okay.
Um, yes, I will also email all of the links and post them to the Facebook page. I will probably not do that until tomorrow, just so everybody has our expectations set clearly.
And I think I've answered this question. I see it continuing to pop up about restrictions for traveling outside of state. So again, currently we are not restricting travel outside of camp, but we live in a world of pivots. And we could say that today and tomorrow the state could change it. So, and we have to follow the state guidelines. So currently it is not a restriction, but please know that it could change. And if it does change, it's really out of our control. And we will do our best to notify families of that change as quickly as possible.
Okay. There's so many questions. I love questions.
Electronics at camp, we ask campers not to bring electronics to camp. We want them to disconnect for a week. No phones. I don't think we mentioned that. No phones. No phones. No phones.
You're right.
Um,
We took out all of those other things we usually do. We'll tell the girls that
yeah.
in their
Yeah, we'll
webinar.
tell. Yeah, we often talk about that with our parents, but homesickness, I think we might have touched upon that. We'll talk about the campers about homesickness too. Hopefully, we're going to keep them so busy that they won't get homesick. But homesick is a part of camp. We really prefer to call it home missing, and it's a natural experience for girls to have at camp. Our staff have it. You know, they miss home too. It's natural to miss home when you're away from your family. So we validate their feelings and we help them work through them.
Yeah.
But they're not sick. They just miss home, and that's okay.
And I'll say, and usually when I talk to parents, it surprises them that the younger the campers are that come to camp, the better that they actually
Yeah.
do. The parents, not so much. They're way more nervous. But the girls, the younger that they are, they actually do a lot better with coping. And it's because of their attention spans. So we have brownies, and they're like, oh, I miss home. But oh, pretty butterfly. So it's really easy to teach them to redirect their energy and their feelings and try and cope with those behaviors. So the younger they are, the better they actually do at camp. When they're older, once we get into like 10-year-olds, then they're attached to not just their family, but also their TV and their bed and all of their accommodations at home. So that makes it a little difficult once they get older, but still easy to manage. We work with each one individually. There's
Um,
a, oh, I was going to say, okay, go ahead.
I was just going to say, Taz, there's so many different emails we use out there. Can you remind me and remind the parents what's the best email for them to use if they have questions?
You got it. I will type it up on the screen if
I know
I can
we
get
have
out of my
customer care, and
slideshow.
then we have, I get a little confused over that.
Camp
Um,
at GS. Oh, I closed the whole thing. So I'll write it in the chat. So camp at gscnc.org will get you to all of us and customer care.
So that's a great place to go for follow-up questions or specific questions about your camper. If it's very specific about your camper and their experience, chances are that will then be routed to the camp director. So you'll get a response from my friend Katniss, Taz, or Sparrow, who had to leave us. If it's registration or payment or transportation changes, then it will likely be answered by our customer care department. All right, well, I think we're at the 8:30 mark. So we've got a lot of work ahead of us. We're going to be working on a Q&A. We're going to be working on continuing to post updates to our website and to our Facebook pages. You'll be receiving a letter. Give us a week to get the letter out about the COVID test. So, we've got some work ahead of us, but we're up for the challenge. And remember, if you know anybody who wants to work at camp, we would love to talk to them. It's a great job. We've been
It's
doing it for a very long time. So
Yeah,
clearly there's something good about it.
it is the best job you're ever gonna have, and I'll be honest, it teaches you more skills than any internship with copying and websites. So
Yes, send us your babysitters. They're great.
There you
send
go.
us your babysitter.
Katniss, great point. They won't need them, right? So because their
Exactly.
kids will be at camp. So send them to us and they'll come back with even more skills.
Okay,
Yeah, no mask while sleeping.
yes. That was that one question, and I would like to touch on that if we can before I close. And
Sure.
it was somebody was surprised because Maryland has a statewide mask mandate, how we could allow our pods to not wear masks. And it's because both Maryland and Virginia agree that when they're pods, they're kind of like a family. So they're living in the same household, but it's just a group of four family members. So it's not really safe to wear a mask while sleeping. Also, I've seen those 8-year-olds and they don't stay still in their bed. So I don't think their mask will stay on their face. We are going to make sure that all the beds are social distance, physically distanced apart. So every camper's head will be 6 feet from another camper's head, which is why we're allowing only 4 kids per bed. But that also allows them to eat meals together, and be in their cabin and just have some mask free time during that experience because they are going to again be considered a family unit. So like a little pod of dolphins, they're going to do everything together that requires no masks. So
We've had a couple of questions about, well, how will campers contact their parents? You, you'll send them with a postcard that's pre-addressed with a stamp on it. Campers do not call home. And this is where we ask you to trust us that, in a severe situation, we'll let the camper call home. And very rarely do they stay after they've heard mom or dad's voice. They fall to pieces and we usually can't bring them back. So part of the camp experience is teaching independence and teaching them how to work through those feelings. And we do it in a sensitive way. And if we think your child is absolutely miserable and not enjoying camp, we're going to contact you. But it's also important to work with your camper and let them know that their counselors are like the moms and the dads while they're at camp. And if they're feeling sad, they need to let their counselors know that they're feeling sad. It breaks our heart when we get a call from a parent who says, my child buried her head in the pillow at night and cried herself to sleep. And if we're not there to actually witness that, we don't know. So, again, start talking to your campers now and remind them that their counselors are there to help them. Similar, somebody's asking about mail. Another tip trick is pre-write letters. And then at drop off, you've got a letter that your camper will get every single day. You just put up in the corner Monday, Tuesday, Wednesday, Thursday, Friday. And then the camp staff will make sure it's delivered on that day. Don't tell your camper you miss them though. Tell them how proud you are of them and how jealous you are that they're having a great time. Please don't tell them that the dog misses them because then they feel guilty because they're having fun at camp, but Snoopy misses them. So then they feel guilty and then they burst into tears. We've learned this over the years. Be real upbeat. I can't wait until Friday when I pick you up to hear about all the fun things that you did. I'm so jealous. It's so boring here.
And for those of you that have downloaded the handout, you may have noticed that there's a bunch of very helpful links to books and websites for first time campers and parents to help you guys prepare before camp. And our camp open house will really be that help the girls set up for success. We'll provide some tips and tricks on how to manage if your camper has a lot of anxiety about being away from home for the first time, and help you set up for that in that open house webinar.
Cameras are allowed. I just wouldn't send a super expensive one, and make sure you've got the camper's name on it. But yes, cameras are allowed.
Okay.
All right, well, this isn't the last time you'll be hearing from us. Again, keep your eye on our website, your email box, and our Facebook page. You might want to join Facebook just for the summer, because it is a great place to get information. But we'll make sure that there are other ways to source the information if you're not a Facebook person, because we certainly understand that.
Okay. All right. So goodbye, everyone. We'll see you next
Yeah, I
time.
guess, yeah, we'll see you at the open houses. All right, good night, everyone. Enjoy your evening.